it requires patient's time, it increases patient's effort, anxiety, and there are other complications with HPOT, most common being eustachian tube dysfunction. Utilization of carbogen, which is more readily available. Hyperbaric oxygen therapy can be also given to the patient as initial therapy or as salvage therapy, that is after 2 weeks and within 4 weeks of the onset of symptoms. Clinicians should not routinely prescribe antivirals, thrombolytics, vasodilators, vasoactive substances, antioxidants to such patients. This results in ineffective treatment and may result in adverse drug interactions. We must avoid unnecessary treatment and the cost due to it. Some example situations are there, like antivirals may be given in those patients in which we think Ramsay-Hunt syndrome is the cause. Always use a patient-centered approach. The outcome assessment is important. Audiometric evaluation of the treatment and at the conclusion of the treatment is important. It helps to determine the benefit of the treatment, identify those candidates who may not have responded or recovered well after initial therapy and who may require a further salvage therapy. We may be able to identify in few cases the then unrevealed causes of sudden hearing loss, and it also allows hearing rehabilitation. The limitation is that the patient may show a statistical improvement in audiogram, but this may not be evident clinically. A pre-sensory neural hearing loss hearing level is usually not or not documented anywhere. So the wisdom is to assume the hearing levels were normal and symmetrical prior to this event or as reported by the patient. No treatment is complete without rehabilitation. So rehabilitation improves the quality of life of the patient in terms of hearing, tinnitus and emotional support. It is time and cost consuming. Patient's preferences must be considered. So the lesson learned is that those who believe that evidence-based medicine is the only reality are wrong. Those who believe that it's a hype are also wrong. And technically, the glass is also true. So extrapolating our wisdom to a younger population, these cases are reported because probably due to poor language development or expression and low incidence per se. Autoimmune causes are more evident than the viral infections. Oral steroids or intratympanic steroids may be given, and to avoid repeated anesthesia or sedation for giving intratympanic steroid, a bromide can be inserted and the patient can be given self-administered steroid therapy. Audiometric evaluation and presentation during treatment and on follow-up is important. Sudden sensory neural hearing loss in pregnancy is yet another condition. Patients usually present during second and third trimester. The causes are usually hypercoagulable state, hormonal changes and immune-mediated disorders. Intratympanic steroids are preferred because oral steroids may be detrimental to the fetus. Audiometric evaluation is again important during treatment and on follow-up. So to conclude, guidelines provide evidence-based recommendations, but yes, they are not intended to represent the standard of care provided to individual patient, not intended to replace individualized patient care, and not intended to supersede professional judgment. The ultimate goal is to provide maximum benefit to the patient. Thank you.
Actually, for diabetics, what will you prefer? Oral steroids or straight away intratympanic steroids?
So we started oral steroids, but in those patients in whom the oral steroids are contraindicated, like level hypertension or a diabetic patient in which the diabetes is not so much controlled, we go for intratympanic steroids.
Would you try for deflazacort?
So?
Deflazacort.
So we have utilized only dexamethasone right now.
Okay, so
I'm in a government setup, sir, and only this drug is available there.
Okay, so what is the time interval between your expectation of hearing comeback after starting?
So in a few patients, young patients in which, like previously I was posted in Bangalore, we had the facility of hyperbaric oxygen therapy. So So in young patients with moderate hearing loss, they have recovered very well within 2 to 4 weeks of onset of the symptoms.
So how often you repeat the dosage of intratympanic steroids?
Sir, in India, since the DEXA comes in a very small dose, that is 4 mg per ml, I go for 3. Our institutional protocol is 3. So alternate day we give the patient intratympanic steroid.
So you put the grommet and then you give intratympanic.
Sir, in adult patient we go for just without promo insertion, sir.
So actually one of the underrated condition, particularly in pediatric education.
Inferior, posterior inferior quadrant, sir. Yes, sir.
Okay. Thank you, madam.
Thank you, sir. Thank you, sir.
Thank you, ma'am.